We'll be talking about community-based approach for comprehensive asthma care. What that means is more focusing on what our Bureau provides in terms of asthma services and interventions, specifically for children with asthma. This is located in our East Harlem Asthma Center of Excellence, which is just a few blocks away from the Action Center. We'll go through a brief overview of asthma and triggers. We'll talk about prevalence of asthma and inequities. We'll talk about our Bureau strategy, as well as the approach for comprehensive asthma care and how to refer families to our asthma services. First, going into what is asthma. So the National Asthma Education and Prevention Program defines asthma as a common chronic disorder of the airways that is complex and characterized by variable and recurring symptoms, airflow obstruction, bronchial hyperresponsiveness, and underlying inflammation. The Global Initiative for Asthma defines it as a history of respiratory symptoms, including wheezing or repetitive coughing, dyspnea, which is just medical jargon for difficulty breathing, and chest tightness, plus variable expiratory airflow limitation, all of which vary over time and intensity. I've thrown a lot of medical terms at you, all of which is jargon. In layman terms, asthma is a chronic lung disease that causes inflammation in the airways, making it hard to breathe. That's what this is all saying, basically. What is asthma? So on the left side, you have a normal lung, someone who does not have asthma. What you're looking at is a normal lung and a normal airway. On the right side, what you're looking at is the lung and the airway of someone who has asthma. So what you see on the left side in the picture that is magnified is an airway. And that's where oxygen goes into the body. That's when CO2 leaves the body. This is where all this essentially goes through. That's this process here. What you see on the left side is that the airway is nice and wide. There's no issue with oxygen and CO2 going in and out in this particular depiction on the left. On the right side, however, you can see that the opening now is much smaller. And this is, again, the airway of someone with asthma. So on the normal side, we have a normal airway. On the right side, we have what we call a constricted airway. Constricted just because it's narrow. And that's due to a number of things. That's because the wall of the airway right around it becomes much thicker because asthma causes a lot of inflammation, and that inflammation causes swelling, and that causes some of these things that we're seeing here. So the wall is thicker, the airway itself becomes tighter. There is mucus inside the airway as a response to the inflammation, and therefore that also makes the airway tighter, whereby oxygen and CO2 have a little less room to operate. You could see also that the smooth muscle around is also now tight, whereas on the left side, the smooth muscle around the airway is relaxed. So all of these findings join together, and that's what causes someone to have an asthma attack. That's what happens in the body when someone's having an asthma attack. What are the symptoms of asthma? We first have coughing, wheezing, shortness of breath, and chest tightness. So all of that inflammation that we talked about leads then to these symptoms. And that's why someone who has asthma will experience coughing, wheezing, shortness of breath, and chest tightness. Now, it's important to remember that all people with asthma are unique. One particular person with asthma may respond to a set of triggers that another person with asthma would not respond to. So every person is unique. But these are generally, the triggers here are the causes of an asthma attack for people. One way I like to think about it is triggers that are outside of the home and then triggers that are inside of the home. And the reason a lot of people actually think about it in this way is that triggers that are inside of the home actually tend to play more of an important part in someone who has asthma because we spend so much time indoors and in our own homes. So what are some of the triggers that are indoors that we're going to focus on here? Bugs in the home, and by bugs I mean cockroaches and mice. We see fungus spores in the bottom right here, which is really mold, and that's a problem, especially in New York City. Cigarette smoke, either in the apartment itself or in the building, and cigarette smoke can get in there. And pets. Pets can be a trigger, not for everyone, but for some people. We're going to focus more on the indoor triggers as opposed to outdoors. And outdoors can be, of course, pollution, cold air, pollen, and things of that nature. But we're going to focus on indoor problems. What you see here focusing on cockroaches and rodents or mice. And we're going to go into what is it that triggers asthma within these little bugs. So for cockroaches, it's dry droplets. droppings. Cockroaches leave dry droppings everywhere. Even if we may not see it, they're there. And those in someone who has asthma can trigger an asthma attack. For mice, it's going to be things that are in the urine, in the saliva, or in the skin of mice. And again, you may not notice those things, but if you have an apartment with mice or with cockroaches, those items will be there, and that can trigger an asthma attack in someone who has asthma. Whereas for someone who does not have asthma, they wouldn't even be aware necessarily. So what do you do when you have these problems? We're not going to talk about medications for asthma. We're going to focus more on the things you could do to get rid of these problems. First, there's pest management services, of course, and a particular type is called integrated pest management services, which I'll go into in more detail later. But these are professionals to help you get rid of these bugs. You can empty the trash daily because, of course, trash attracts mice, for example. Store them in trash containers with secure lids. Use traps. Store food in containers that do not allow these animals to access the food. Fix plumbing leaks and any sort of moisture. Don't leave any sort of food or crumbs on the counters or floors, and remove piles of boxes or newspapers or any other place they can call. We're going to look at mold. Mold is a very important trigger of asthma, again, as I mentioned, especially in New York City, but not unique to New York, of course. The important thing to remember with mold is moisture control is equal to mold control. What that means is after you take a nice hot bath or hot shower, there's a lot of steam and a lot of water everywhere. What you want to do is dry the tiles after you use the bathroom, open the window to remove any sort of humidity, because again, humidity will lead to mold. So you want to get rid of humidity. Open the doors, open the windows. If you can use a mold-proof shower curtain, go ahead and do that. Any sort of missing grout or leaking pipes and faucets that will lead to humidity, try to do your best to fix that. Scrub mold off of hard surfaces with detergent and water, and use green products, because some products out there are actually toxic and are not good for your health or the health of your child. So you want to use green products. We're going to go a little bit into case studies to show you a little bit of what I mean in apartments. In the kitchen, you can see highlighted are areas of potential concern, and you'll see a trash, and that's just in a regular trash bag, not in a container. You have an exhaust fan that maybe hasn't been cleaned in a while. You have dishes that are on the countertop, and where there are dishes, there's usually water. Is that water still there on the surface for cockroaches to have access to? And so what you want to do is empty the trash daily, use insect and rodent traps, repair leaking faucets, use exhaust fan when you cook to get rid of chemicals, and of course clean the exhaust fan, because that can contain a lot of dust, and if it's not cleaned regularly, that could be a source of problem as well. In the bathroom, you want to wipe dry the tiles after you use them, open the door to remove any sort of excess humidity, change the shower curtain liner often, because mold can grow on there because of the humidity, so you want to keep that in mind. Repair any sort of missing grout and leaking faucets, and those are one of the highlighted things, is actually missing grout. And then again, as I mentioned, use green products for cleaning. In the bedroom now, mold is less of an issue, but cockroaches and mice still are. And then dust mites are an issue here. What you want to do is put pillows and mattress inside dust mite proof covers. There are such things, containers for pillows and mattress covers that basically protect against dust mites. And dust mites, again, are also another big problem in terms of triggering asthma. You want to vacuum and dust every week. You want to wash sheets and blankets once a week in hot water. Hot water, because that kills dust mites much more so than cold water. And keep stuffed toys off of bed for that same reason. Keep pets out of the bedroom, because pets can be a trigger, and keep food out of the bedroom so it doesn't attract animals, pests. This is just a case study of some of the things you could do if you or someone you love in your home have asthma, and some of the things to keep in mind. Having gone through what asthma is and triggers, now we're going to go into prevalence, how common asthma is. Nationally, we know that some populations are much more likely to suffer from asthma than others. This is from the CDC. As of 2022, indigenous populations and Black populations were much more likely to have asthma than other groups, and Asians were the lowest in terms of asthma prevalence. Looking at New York City, specifically looking at children, we know that asthma is the most common chronic childhood illness. In New York City, 12% of children ages 0 to 13 have an asthma diagnosis. It is the most common reason for hospitalization and ED visits among children in New York City. So this is a big problem. Every year, at least 1,000 hospitalizations for children in ages 0 to 4 and also for children ages 5 to 17. So again, it's a big problem. On top of hospitalizations and emergency room visits, it accounts also for the biggest cause of missed school days compared to any other chronic disease. So just all this to highlight is that asthma is a big problem. What we know also is that the highest rates of asthma-related emergency room visits correlate with neighborhoods that have the worst housing quality. And that should come as no surprise, as we talked about in terms of cockroaches, mold, indoor triggers, which are going to be in the home. This graph map on the left side shows a map of New York City. The areas in darker blue are the areas that have the highest rates of emergency room visits. The areas that are highlighted in red are areas that have the worst housing quality. And what do you see? The areas with the worst housing quality are also the areas with the highest rates of asthma-related emergency room visits. And of course, you can see East and Central Harlem. So what we know about that is that children living in East and Central Harlem experience high rates of asthma-related emergency room visits, as well as asthma-related hospitalizations. And it should also come as no surprise that in East Harlem, 71% of renter-occupied homes had health-related housing problems. It just drives home the point, housing problems and asthma go hand in hand. You have to deal with the housing problems in order to address the asthma problems. So again, looking at triggers of asthma attacks in homes in New York City, you'll see from left to right, cockroaches, mice, tobacco smoke, and underneath water leaks. The areas in darker red are the areas where that's the biggest problem, where the most amount of homes are reporting this issue. And same areas geographically as we've looked at in terms of asthma-related emergency room visits, which you can see on the bottom right, and asthma-related hospitalizations. All this to say is you have to address cockroaches, you have to address mice, you have to address tobacco smoke, you have to address water leaks and water leaks leading to mold in order to be able to have asthma under control. So that's one of the biggest challenges in New York that communities will face. What is our Bureau's strategies? Our goal in all of our asthma programming is focused around reducing asthma-related ED visits and hospitalizations for children ages 0 to 17 in East and Central Harlem. And we do that through a number of ways. This is our Bureau of Harlem Neighborhood Health. On the right side is the East Harlem Action Center with all of our own programming and then programming by our co-located partners, which of course include SMART, which you'll see represented here. And then on the left side is our EHACE, East Harlem Asthma Center of Excellence. We are on 110th Street, so a few blocks away from the Action Center. And EHACE does a lot more than just asthma, but what I've depicted here is only our asthma programming. So we have a number of asthma programs, 5. We're only going to focus on 2. Our ACP or Asthma Counselor Program, and then our IPM, Integrated Pest Management, our Asthma Counselor Program. This is a neighborhood initiative that uses a comprehensive approach for asthma management. It's a social worker-led model that provides intensive case management, asthma education, and environmental interventions, as we've talked about being some of the triggers, to address the needs of children with asthma and their families. We have social workers based out of our EHACE building, located again on 110th Street, and we have social workers based in our hospital partners, which are Metropolitan and Mount Sinai hospitals, which are also not far from where we are. To qualify for this program, you just have to have a child younger than 18 with an asthma diagnosis who lives in East or Central Harlem. The program is free of charge for families. You come to us just with a child within this age range who has asthma. We'll partner them with a social worker who will work with the child and the family for usually about a year. The asthma counselors are master's level social workers who provide individualized asthma support. They assess for social needs, anything else going on in the home other than asthma that could be a problem for the child and for that family, to help make sure that there aren't any sort of barriers that haven't been talked about or addressed. They'll provide appropriate intervention. They'll refer to appropriate services if they find a barrier. So anything and everything to help that family get to a better place from every standpoint. So that's what the Asthma Counselor Program is, or ACP for short. As I mentioned, for about a period of a year, a social worker will work with that family, with that child, to address a number of things. They'll provide one-on-one counseling. They'll assist with medication management. They'll advocate on behalf of the child and the family. They'll refer for environmental services. They'll coordinate with the child's doctors and the schools, making sure that everyone's on the same page. On top of that, our social workers are able to give presentations on asthma and educational workshops. In terms of the program's outcomes, we published a paper in 2022 in the Journal of Asthma, which looked at how the children performed in this program. What this chart here says, I'll just break it it down simply is that over the course of a year, children had less daytime asthma symptoms, less nighttime asthma symptoms, less hospitalizations, emergency room visits, or urgent care visits due to asthma, and less missed school due to asthma. In a nutshell, children did a lot better after a year in our program. And again, this is a paper that was published in 2022. We don't just focus on the child's asthma. We look at the family holistically. We try to assess what barriers they have and how we can help them. What are some of the things that our families are reporting to us? To no surprise, a lot of them are having housing issues, and then there's a slew of other issues that they report, and our social workers will work with them on each and every one of these to try to help them. If they can't help them directly, they'll look at community-based services that they can refer them to so that they can receive the assistance that they need. But we're going to talk about housing because as housing is a big barrier here, and we have to focus on that. Among the families reporting housing issues, 3% reported having cockroaches in their homes or buildings. And it's important to note that just because you don't see cockroaches in the apartment does not mean they're not there. We know for a fact that they can be there through testing of their excrements. We can find out that they're there even though a family can report that they're not there at all. So that's a big issue. 32% reported problems with leaks, poor ventilations, holes needing repair, mold, mildew, and then 30% reported having smokers in the homes or buildings. And each of these things, of course, can trigger asthma attacks. Again, our social workers will work with families to address these issues. Now talking about our integrated pest management service. So the first thing I'll say about the service is that this service is a standalone program. You don't have to be part of the asthma counselor program to be eligible for this integrated pest management intervention. You could reach out to us and say, I have a problem with a pest. There's a child aged 17 or younger with asthma in the home. Reach out to us and we'll schedule with a technician, an expert that we partner with to address this issue. So integrated pest management is a way of addressing pests. By pests, I mean, again, cockroaches and mice using non-toxic methods. And that's important because some services out there use toxic products that can cause breathing issues, eye redness, skin issues, and even trigger asthma attacks, among other things. So integrated pest management is a specific type of program that does not do that. On top of that, the technicians educate families on how to reduce indoor asthma triggers. What you could do if you have cockroaches and mice and mold in the homes, they will provide that level of education and even more detail of what you can do. To qualify for this program, you have to have one child, 17 or younger, with asthma in the home. Report to us that you have cockroaches or mice in the home. You have to live in Manhattan, Brooklyn, Queens, or Staten Island. Why not Bronx? Is because we have a sister bureau in the Bronx that will take care of those referrals if they come from the Bronx. So you can still let us know if you're in the Bronx and we'll connect you with that bureau. You have to be willing to let the IPM, Integrated Pest Management Technician, into your home to do the service. You coordinate with them a date that works for you. They'll tell you what is needed beforehand, and then they come in, you let them in, they do their work. And it's important to mention that the technicians do not tell the owner. So if that's a concern of yours, just to put that at ease, the landlord does not have to know. You just refer to EHACE at health.nyc.gov. And you mention to us what the problem is. We'll help you with that. And I'll show the referral forms as well. This is now just showing a few pictures of what the technicians do and some of the products that they use. And again, the idea is to use non-toxic green products that don't have any sort of known health effects in humans so that you could get rid of the problem without causing another problem. We do satisfaction surveys after each intervention. You'll receive a survey to fill out to see how the service went. And generally, families are very satisfied with the IPM technicians and the level of service that is received. If for some reason after the IPM technician leaves and there's more issues that you notice with either mice or cockroaches, we can have the IPM technician return again until the issue is resolved. This is essentially our referral forms, our asthma cancer program, or ACP referral form, and then our integrated pest management or IPM referral form. And each program is separate. If you're part of the ACP, the social workers can take care of everything, including an IPM referral. But if you don't need the ACP program and you just want the IPM intervention, that's also totally fine. You could just fill out the IPM referral so long as you're eligible based on the criteria shared, and can work with the vendor to schedule you with them to take care of the problems you have.
People who have asthma are at higher risk of more serious illness from COVID. I don't know if there's a connection yet been made between people who have asthma and long COVID, but certainly getting your COVID shot is good protection against long COVID as well, keeping those things in mind.